This video is for educational and instructional purposes only. This is your CADD pump. A cassette with your epidural infusion will come looking similar to this one. This one's very old, as you can tell, from 2011. So please take note that your label will likely appear differently than it does now. But two nurses should verify what is on the label to ensure that it is the correct concentration and medications as reflective in the order set. So this would be ropivacaine 0.1%, fentanyl 2 mics per ml. I believe our current labels now will also have the patient's name and MRN number listed on them. And this will be your CADD pump and how it will look. The clamp, your tubing. Note, obviously this one does not have the cap on it. This is again a pump that we use, or I'm sorry, a cassette that we use for training purposes only. Going back to your CADD pump, your power button is on the side and it looks like that. And you would just press it so that your screen would turn on. Sorry about the reflection there. So this will be your initial screen that will pop up, and you would say yes, you want to start a new patient, and using these buttons below. Then you would have to select that it is an epidural and what age range you're needing the epidural for. Let's just select, for our purposes in the NICU, a patient who is between 3 to 12 months old. You would use your arrow keys to move down and up, and the select button when you are ready for that choice. Then you would select the patient's weight, and we do it by ranges in our pumps. So again, for instructional purpose, let's just say between 5 and 10 kilos. Select. This is where we have to confirm that the medication that we're choosing in our library at the pump matches what it would be on our cassette. So as you recall, on our cassette here, we saw that it was ropivacaine 0.1 with fentanyl 2 mics per ml. Moving on to the pump, you're going to scroll down to ropivacaine 0.1 with fentanyl 2 mics per ml. Hit select. You would have to enter the code, which is 1, select, and just use your arrow keys to go up 5 and 9. As you can tell, when I was selecting the numbers, you do not hear the beeping as I'm scrolling through with the arrows, and that's purposely done just so that if you're next to a patient's room, the family is not noticing what the code is, because anybody can punch in this code and then make changes to the pump. So 159, and then you want to verify that the following information is correct. And the age of the patient, the weight of the patient, the medication and concentration, and then hit yes. If you were to hit no, you'd go back and change whatever you would need accordingly. This is where you want to review pump settings, where now you're going to look again at your order and see what you need to change. So our labels now should have a rate on them. This one does not. But let's just say for instructional purposes, our continuous rate is going to be 3.5. We would select continuous rate and just scroll up to the appropriate number as per your order, and then hit select. Actually, let's go into a green zone here. So when you're into a red zone, that's sort of going above the recommendations. So let's hit 3 instead. Select and save. PCE A dose, it would be a epidural which would have a demand dose with a button attached to it. As you can see, these pumps come with a button that the patient could push to give themselves a demand dose. That we use that more obviously with our PCAs, but also some of our older patients who have epidurals. Therefore, you would not see this option in our epidural or NICU babies and patient population. So that would just remain a 0. 1 hour limit should match your continuous rate. So we'll hit select, make that a 3. Save. Reservoir volume, all of the cassettes are 250 mLs. And it would say on the actual label as well, there it is, 250 mLs. My understanding is the NICU cassettes will still be the same size. I believe the pharmacy may look into making them possibly smaller since it's a smaller volume for our smaller patients. But more than likely it will remain at 250 ml cassette. And that's your reservoir volume. So at this point, you're going to accept each value, which would be this button here, to verify. And this again has to be done by 2 nurses. And when you accept and verify, you'll see green check marks come on the left-hand side. You'll hit next. And then it'll give you this message, cassette not attached, attach cassette before starting the pump. So in order to do that, you will need your CADD pump key into the lock right there. So you'll put that in and you will unlock it, pull the lever down, then you can attach your cassette, and I'm going to show you the bottom of this pump so you can kind of get an idea of how the cassette will attach there. Okay, so you're going to put your cassette in there. Sorry, I'm trying to do this by myself. Sometimes you'll just have to hear a click to click it on, okay? Pull your lever up and then lock it again and pull out your key. Once you've done that, it'll say, as you saw above, cassette locked up there. Let me just unlock it again for you to see how the pump will recognize cassette unlocked, because I just turned the key, and cassette locked. Okay, and pull the key out at this time. Then you'll get this message, and this screen says prime tubing. You do want to hit yes. I'm going to disconnect the tubing from the patient if it was connected at any point, but it shouldn't be. Open up any clamps, which your original tubing will have a clamp here. So you open up that clamp, and then you can press prime. And you'll prime your tubing. You may see air in this tubing, just because I basically had to put water in this play cassette that we have here. So I stopped the priming, and it says continue priming. I'm gonna select no, excuse me. Start the pump and select yes. And that's it. And you're all done.